Madam Tan Kim Chu.
Hello, Madam Tan. I'm Dr. Lim.
Where is Dr. D'Souza? I don't want to change doctors.
Dr. D'Souza is your surgeon. I am an anesthetist. But don't worry, we work as a team. It's my job to make sure you are safe during the surgery and are comfortable afterwards. We will be looking after you while Dr. D'Souza is operating.
Oh, I see.
For your surgery, you may be given a regional anesthetic. This involves giving you a small injection in your back to numb the nerves, allowing the lower half of your body to be numb throughout the operation.
Huh? I'm going to be awake for this surgery? Isn't that very scary?
There will be a screen that blocks your view, so you won't be able to watch what's going on during the surgery. We can also give you some sedation, so you'll feel slightly sleepy and less anxious during the surgery. But of course, the sleep won't be as sound as if you had a general anesthetic.
But what if I feel pain during the surgery?
We will ensure that you are properly numb before Dr. D'Souza starts. But if you do feel any pain during the surgery, just let us know. I have some questions about your general health. So, are you feeling okay to continue?
I guess so.
Are you taking any medications?
I am, for my high blood pressure and diabetes, but when I'm feeling okay, I tend to skip my medication.
Madam Tan, you must take your medicine regularly. If you do not control your medical conditions, we may need to delay your operation.
I see.
When you come for surgery, you must have an empty stomach. That means no food or drink for at least 6 hours before surgery.
Why? I thought you only have to fast if you are having a general anesthetic.
Sometimes, we will also give you medicine to make you feel a bit more sleepy. Moreover, there is a small possibility that the regional anesthetic may be inadequate, and we may still have to give you a general anesthetic. If you have a full stomach while under a general anesthetic, food and liquids from your stomach can rise up to your throat and go down to your lungs. This can lead to serious lung complications.
Oh, I didn't know that. Okay, I'll fast for at least 6 hours.
If you fall ill in the next few days, please let Dr. D'Souza know by calling his clinic. You might need to have the surgery postponed till you are better. Do you have any other concerns?
Will I get a backache after this?
The back injection may cause a slight ache for a few days, but it shouldn't cause long-term back problems. Anyway, did you know that people with back pain sometimes come for a similar injection to treat their back pain?
Oh, I see. Well, if this injection is used to treat back pain, it shouldn't cause me too much problems then.
Most people will experience numbness and weakness in their legs for several hours after the surgery. So, when you try to get up and walk after a regional anesthetic, do be sure to have someone beside you. There is a small risk of causing headaches, and there is an even smaller chance that you might have a permanent patch of weakness or numbness in your leg. So if you do have persistent headaches, weakness, or numbness in your legs after the injection, do let us know.
I heard from my friend that patients can suffer a heart attack or a stroke if you go for surgery. Is this true?
Yes, there is a small risk of heart attacks and strokes. Patients with pre-existing medical conditions will be at higher risk, and we take extra care to monitor these patients closely during and after the surgery. Although you do have hypertension and diabetes, these appear to be well controlled, so I do not anticipate any major problems for your surgery. Let's proceed with the physical examination. Don't worry, Madam Tan. You'll be okay. Madam Tan, I will be giving you the regional anesthetic now. Don't worry. Nice deep breaths. How are you feeling?
Is the surgery over?
Yes, you are doing okay. Let me give you a warming light and another blanket. Are you feeling any pain?
No.
Your legs are still feeling numb from the regional anesthetic. But if you feel any pain later, just press this button. And this pump will give you painkillers through the drip in your hand. And remember, be careful when you try to walk. Your lower limbs will still feel weak.
Thank you, doctor.
Have a good rest. Dr. D'Souza and I will check in with you again later.